When law enforcement is called to a situation that involves a mental health crisis, there's a collaborative effort between local officials and a mobile evaluation team that deals with psychiatry called MET. New at 11 p.m., 23 ABC's Kylie Walker explains how this collaboration started and how they work within the community. Kylie?
Jazz officers have been able to call for a mobile evaluation provider since the 1990s. However, back then they only had 3 MET providers, whereas now they have 14. But with mental health concerns on the rise, both law enforcement and MET providers would like to see that staff expand. The mobile evaluation team is not meant to replace officers. It is rather an added resource, with both groups balancing each other out.
We work with them a lot. We have a great partnership with mental health. We love that partnership and we want to continue it.
And we want to do the best job in serving our community, so having that as a resource available is definitely better for us all.
But the director of Kern Behavioral Health and Recovery Services, Bill Walker, who launched the MET over 20 years ago, says there are some situations they won't enter until it's been deemed safe by law enforcement.
And so when people say, well, you should have more mobile evaluation people when someone becomes violent, you have to watch those tapes and see how quickly someone escalates into violence. And so the training there is different in what you need to address.
And another issue they have encountered, covering the entire county with limited staffing. But for now, with specialized funding, they were able to start a virtual MET program,
where you could have an officer or one of the police departments up in one of the mountain ranges or somewhere out in the desert, and it's very hard to get a unit to them, even if you had someone available right at that moment. They can actually log in on a specialized HIPAA-compliant iPad and talk to our staff and get the consultation they need in the field.
So what does it take to become a MET provider? Well, Walker says training takes several months, because candidates must learn all of the law enforcement dispatch rules and regulations, as well as all the intervention strategies. And the MET teams bring in patients to an evaluation center where their mental health will be treated.
They average over 600 admissions a month. We have a crisis walk-in clinic that shares the same area. They're over 300. Between those two, that's 1,000 people a month. At any given time, Kern BHRS is treating over 15,000 people in Kern County for mental health and substance abuse problems.
Now, if you or someone you know is in need of help, we will have a list of numbers on our website, turnto23.com, as well as a link to the different crisis services throughout the county. But for now, reporting in Bakersfield, I'm Kylie Walker, 23 ABC, connecting you.
All right.